Hi everyone, I'm Fazla Hamim from Speech Inc. And today I'm going to share with you top 5 questions parents ask about speech therapy. So this is a continuation from my previous video where I discussed about what to expect on an assessment day, what we do after our assessment. So this is what happens after our assessment. So these are a few questions I have been asked from parents regarding our speech therapy. So let's look at it. First question. So just to give an introduction, like I mentioned, this is just a quick Q&A for parents starting the journey. And these are the 5 most common ones that I have been asked. So first one, how long will therapy take? So again, this one depends on your child's individual needs, goals, and progress. If it's a delay, if the child is having autism, the child will need a certain amount of therapy throughout for maybe few years. But when it comes to an articulation difficulty, which is if the child has difficulties with pronunciating um, a word or a sound, that will be much less. So it depends on the individual needs and the child's goals. So the factors that affect duration again is the type and severity of the issue, the child's age, and the attention span. So if the child is more of a early uh, early language child, so the child will need more time to develop, and the child needs to work on his attention span to work on more longer tasks. So consistency of sessions. So if we have our sessions every week, maybe twice a week, this will help us uh, see more progress, whereas having one session and then not being available for 2 3 sessions and coming back again, practice at home is another key factor when we are checking the child's progress. So some children may only need a few months, like I mentioned, and others might need long-term support. So as I always say, speech therapy is a journey, it's not a race. Every child has their own little journey and it will adjust the plan as your child grows. Another question I am always asked is, can parents sit in during session? So if it's an online session, yes, definitely the parent will be present next to the child within therapy. But when it comes to an in-person session, depending on the child's age and the child's requirements. Sometimes we might have the parent within the therapy room so the child feels more comfortable, or sometimes we might leave the parents um outside the therapy room, but they will be able to observe the therapy session. So, benefits of joining in the therapy session is you get to observe strategies used by the therapist, and these could be used at home. You can reinforce this learning at home, like I mentioned. You can by seeing how the therapist work with your child, and it helps ease your child's anxiety. Sometimes the therapist may request a parent to step out briefly if the child is more independent. So that way, this needs to be discussed beforehand with your therapist and with the therapy place. So is online therapy effective? So this is another question I get most of the time because we do our therapies online. Yes, I have been doing this online therapy session since COVID. That's more than almost 5 years. So many children have made great progress throughout teletherapy. It could be the pronunciation, that's articulation, or we've had children with delays, with autism, with Down syndrome who've come to us, and with CBI who worked with us throughout these years, and we've seen great progress. And now they have paused on, and they're doing great in their school and their other sessions. So online therapy sessions works well, but the parents need to understand that these online therapy sessions work well when the sessions are consistent. Like I mentioned before, it's not only online sessions, even when it's an in-person session, it'll work well if the sessions are consistent with parents coming in on time, by parents attending all sessions. Um, And if you're having 8 consecutive sessions, it will give more progress rather than breaking it up and having more breaks in between. And again, the parents support, uh, when the parents support the child, this will also help the child's development and the child's progress. The therapist adopts tools to suit the child's attention level again. So this might be maybe an iPad, an AAC device, maybe it's just a PEX where we use picture exchange. So it depends on the child's attention level again and the child's level of communication. It's especially useful for children who are comfortable with screens and routines because it's not easy to sit in one place and communicate with a therapist for 30-45 minutes depending on the child's attention span. But this might be different for a person who's in person, a very young child who does this therapy in person, because it might be more of a play-based therapy. However, if your child is a very young child, we could offer parent coaching sessions where we therapists support the parents and provide the parents with tools and goals on how to work with your child at home. And this will give the parents an idea as to how to support the child's speech at home. We'll be using the Hanan program mainly if the child has a speech delay, or we'll be using many other methods. So I will do another video on how we do parent coaching sessions for parents with very young children. Will insurance cover it is another question I always get. So it depends on your location, again, your insurance provider and the therapy clinic, if it's a private clinic or if it's a government. So first of all, you have to check with your insurance if your speech and language therapy is included. And again, you need a referral from a pediatrician in order to do that. And if reimbursement or direct billing is offered, and some clinics offer packages that might be less cheaper if you're going without an insurance. So check on that. Another question I get is, what can I do at home to help? So as parents, you can do lots of things. Parent involvement is a key for faster progress. So this is what I mentioned, that the importance of being part of the therapy. This will give you more strategies, as well as by having by participating in parent coaching sessions, you will be sharing more strategies on how to work with the child, the goals we are working with the child currently. And it also um, helps parents. For example, we will share ideas on how to create play-based routines to encourage speech at home. So, additionally, you can read together, repeat new words, and we can celebrate small wins because every word counts. And you can ask your therapist for a home practice plan too. And if you're doing your parent coaching session, this will be part of that plan. So, like I mentioned, those are just 5 simple questions that I have been asked very commonly by many parents that I've got. So, in summary, I should say that we should support your child together. We are a team. So, it's important that we do work at therapy as well as at home to help the child's progress. So, if you have any questions regarding this, just drop me DM on Speechink or drop me a comment, and I will happily reply to your questions. So thank you for watching. Thank you for being part. In my next video, I'll be sharing more details about what is parent coaching and how we do it with our parents. Thank you.